Mental disorders. Anxiety. If anxiety continues for a long time, it can seriously hamper daily living, leading to more anxiety. Anxiety makes a person vulnerable to physical and mental illness. Some of the things that people feel anxious about are financial problems, legal problems, health, children and family, job promotion, examination, choosing a career, relationships. Symptoms: dizziness, breathlessness, inability to concentrate, nausea, peculiar feeling in the stomach, shaking, trembling, insomnia, muscle tension. Advise the patients to consult the psychiatrist or physiologist when you find that anxiety is seriously affecting daily life of the patient. Patient is unable to control anxiety through his or her own efforts. Patient has so many of the symptoms of anxiety that he or she is always worried about the state of health. What the psychiatrist or physiologist can do? They may carry out certain psychological tests of personality. They may use medication, psychotherapy, or counseling. Please warn the patients not to take medication for anxiety without the advice of the psychiatrists. Depression. Depression is a common mental disorder characterized by sadness, loss of interest or pleasure, feelings of guilt or low self-worth, disturbed sleep or appetite, feelings of tiredness and poor concentration. Causes: life events, heredity and personality makeup, physical factors such as changes or imbalances in body chemicals. When to advise the patient to seek help of psychiatrist or physiologist? If you notice some of the signs of depression, loss of mental and physical energy mentioned above are taking over and disrupting the daily life of the patient. Treatment of depression: psychotherapy, medication, psychological testing, hospitalization. Stress. Stress is the physical and emotional response necessary for dealing with situations that are frightening, confusing, exciting, or tiring. But if there is too much stress, it can trigger off many diseases and disorders. How to recognize stress in patients? Body changes, feelings, behavior, sweating, fear, avoidance, shaking, anger, criticism, high blood pressure, depression, denial, racing heart, restlessness, escape, dry mouth, irritability, violence, choking sensation, insecurity, churning stomach, confusion. When to advise the patient to seek help of the psychiatrist? That stress is creating so much tension in the patient that there is a continuous feeling of stress for a long period, that the symptoms of stress are too acute for him or her to cope with, that patient is developing physical illnesses very fast, that his or her well-wishers are feeling a change in his or her nature. What can a doctor do for his patients to deal with stress? Examine aspects of life and try to identify sources of stress. See what can change these situations. Think of the skills patient needs to deal with situations. Advise the patient to learn methods of relaxation. Obsessive-compulsive disorder. The signs: over-concern with cleanliness, over-concern with routine, lessened interest in social activities, uncertainty about his or her own judgment. A tendency to get too upset about minor things. Over-concern with detail. A tendency to get tired easily. Treatment of obsessive-compulsive disorder. Medication. Behavior therapy. Family therapy. Mood disorders. Signs of abnormal mood swings. Feeling high, everything seems wonderful. Fast flow of ideas. Talks too much, too loud and never sticks. Seems not to need sleep. To one topic, distracted easily. Highly energetic and active. Impatient. Interfering. Insensitive to other people. Treatment of mood disorders. Medication. Work therapy and exercises. Psychotherapy. Schizophrenia. Physician to record complaints of the following: laughing or talking to oneself, getting angry or crying without any apparent reason, complaints of hearing voices when alone, complaints or ideas that someone is after him or her, not carrying out his or her own usual daily routine, sudden lack of care about personal grooming and hygiene, serious disturbances in sleep or lack of appetite, person reporting that he or she is seeing things others do not see. Treatment. Schizophrenia is not a disorder which can be cured. That is to say, it can come back again at some later time, but it can and must be controlled because the disease can prevent the person from living a normal life as well as prove damaging to the person's family. With treatment, the person can improve enough to live a near normal life. Panic attacks. Symptoms: feeling that one cannot breathe properly, racing heart or palpitation, trembling, sweating, tingling sensations, hot flushes, nausea, chest pain. Treatment of panic attacks. The disorder of panic attacks is treatable. It is usually a learned response to stress, and it can be unlearned. The psychiatrist or psychologist treating the problem will work out a program of behavior change during which the person will be exposed to the panic-producing situations. He or she will be helped to face the situation with relaxation techniques. Biofeedback can also be very helpful in reduction of anxiety. Phobia. Phobias can be divided into these main groups. Fears of situation, such as being on top of a high building, in a confined space, at school, at work, agoraphobia and claustrophobia. Social phobias or fear of social situations. Fear of a specific illness, of dying or death. Fears of specific objects, simple phobia, such as mice, cats, snakes, numbers, etc. Treatment. Medication. Psychotherapy. Behavior therapy.